liver cancer. Some people with chronic hepatitis B may have no symptoms at all. Some may have ongoing fatigue and mild symptoms of acute hepatitis. So let's have its structure. Hepatitis B is a member of hepadnavirus family. It is from hepadnavirus family, the virus particle called Dane particle virion. It consists of an outer lipid envelope and an icosahedral nucleocapsid core composed of protein. This is similar in many ways to other viruses. In the core of the virus, it is the genetic material, DNA, and the enzyme DNA polymerase, which are surrounded by a capsid or a protein shell. So the entire virion or virus structure is then surrounded by the envelope. So on the DNA, the genome of HBV is a partially double-stranded circular DNA of about 3.2 kilobase KB pairs. The viral polymerase is covalently attached to the 5' end of the minus strand. So when it comes to its life cycle, schematic representation of the human hepatitis B or HBV virus life cycle, after, as you can see on the picture kung nakikita siya, after binding to the high affinity receptor or the sodium taurocholate co-transporting polypeptide or the NTCP, HBV is internalized via endocytosis, and the viral capsid is released into the cytoplasm. The capsid travels to the nuclear pore using the microtubule network. The rcDNA is released in the nucleus and is converted into covalently closed circular DNA or cccDNA, which becomes chromatinized and is the template for the transcription of all HBV RNAs. Sa cytoplasm, pgRNA is encapsulated and retrotranscribed into rrcDNA. The capsid are then either enveloped at MVB and secreted as new virions or transported back to the nuclear pore to increase the pool of cccDNA. And then, symptoms, again, parehas lang siya sa hepatitis B, pero sabi nga kanina, it has no symptoms at all, pero some symptoms, ito nga ulit, fever, malaise, loss of appetite, diarrhea, nausea, abdominal discomfort, dark-colored urine, jaundice, or yellowing of the eyes and the skin. So, sa epidemiology naman, hepatitis B infection comes from the hepatitis B virus nga, HBV. The virus spreads through bodily fluids. Dito naman sa B, bodily fluids naman siya. Transmission occurs when fluids from the body of a person who's infected enter the body of a person who's uninfected. So this might happen through first childbirth, sexual contact, contact with an open wound, sharing needles or syringes, sharing a toothbrush or razor, and accidental stick from an infected sharp instrument. And on its diagnostic test naman, healthcare providers will examine the patient and look for signs of liver damage such as yung yellow skin or belly pain, kanina na jaundice. Tests that can help diagnose hepatitis B or its complication are, so we have blood test. So blood test, it can detect signs of the hepatitis B virus in your body and tell your provider whether it's acute or chronic. So a simple blood test can also determine if you're immune to the condition. Next is liver ultrasound. A special ultrasound called transient elastography can show the amount of liver damage. Next is liver biopsy. So dito, the provider might remove a small sample of your liver for testing to check for liver damage. This is called a liver biopsy. During this test, your provider inserts a thin needle through your skin and into your liver and removes a tissue sample for laboratory analysis. The diagnosis of HBV infection requires the evaluation of the patient blood for HB-Sag or hepatitis B surface antibody, HB-Sag, and hepatitis B core antibody or HB-Cab. Although the presence of HB-Sag indicates na yung tao is infectious, the presence of HB-Sag indicates naman recovery and immunity from hepatitis B infection or successful immunization against HBV. Yung HB-Cab appears at the onset of acute hepatitis B virus infection but may also indicate chronic HBV infection. So, ang first-line drug treatment naman, hepatitis B immune globulin or HBIG. HBIG is a substance made from human blood containing naturally produced antibodies to the hepatitis B virus. It's given as a shot to help prevent infection in people who've recently been exposed to the virus. So sabi, there is no specific treatment for acute hepatitis B then. Chronic hepatitis B can be treated with um, you're going eat by eating a healthy diet and drink plenty of liquids to prevent dehydration from vomiting and diarrhea kagaya sa hepatitis A. Pero sabi, there are specific medication for chronic hepatitis B daw. It can be treated with oral medicine such as tenofovir or entecavir. So most people recover completely but a few develop chronic hepatitis B. If severe naman or fulminant hepatitis develops, ayun nga, ang sabi ko kanina, yung antiviral drugs can help, kagaya nung tenofovir or entecavir. So, but the best hope of survival is sinasabi ay liver transplant. And then, meron ding vaccine for hepatitis B, which is a hepatitis B vaccine or HepaV vaccine. Ayun po.
Okay, informalize lang natin siya. One moment lang. Okay, may isi-send akong picture sa messenger. Kindly look into this one. Tapos i-zoom ninyo. So para mag-discuss tayo dito ng life cycle. Okay? Pero maya-maya ng konti yan. Ano muna natin yung morphology niya. So, sabi ni Miss Aba kanina, okay, ang hepatitis B, okay, punta tayo dito sa hepatitis B. Ang hepatitis B ay under Hepadna viridae. Okay, ang family ay Hepadna viridae or Hepadna family, Hepadna virus family ang sabi ni Miss Aba. But then sa micro or even in public health, pag family ang pinag-uusapan natin, viridae. Okay, kapag single virus ang pinag-uusapan natin, virus ang tawag natin sa kanya, viridae pag family. Okay? And then ang mga Hepadna viridae meron silang double-stranded circular DNA. Tama? Meron silang double-stranded circular DNA. Ano ang pinagkaiba niya sa hepatitis A? Meron silang single-stranded RNA, ang hepatitis A. Ang hepatitis B, double-stranded circular DNA. Ano pa ang pinagkaiba niya sa hepatitis A? Envelope ang inyong hepatitis B. Meaning, anong meaning kapag may envelope? May nagpo-protect doon sa loob ng nucleus. So, ibig sabihin, hindi natin siya basta-basta mapapatay kasi meron siyang envelope doon sa loob. Okay? Meron siyang protector. In terms of the capsid, pareho sila. Ito ang similarity nila. Meron silang icosahedral capsid. Nasa PowerPoint naman. Now, Miss Aba, pakibanggit nga ulit, ano yung Dane particle na sinabi mo kanina?
Ang Dane particle, sir, is yung virion, it is a virus particle na merong outer lipid envelope, tapos yung icosahedral nucleocapsid core na composed ng protein. Yun yung virus particle, sir, ang Dane.
Okay. This Dane particle is a virus particle that there is an outer lipid envelope. So, ibig sabihin, yung envelope niya, lipid ang composition niya. In other words, pag sinabi natin Dane particle, this is also called as intact virus. Ibig sabihin, pag sinabi natin intact, hindi mo siya makakabog agad. Kumbaga, hindi mo siya mapapatumba agad. Okay? Kasi nga, yung envelope niya matindi. So, ibig sabihin yung DNA niya, kahit nasirain mo yung dun sa labas niya, intact yung loob ng nucleus niya. So, pwede pa rin siyang magkaroon ng replication regardless kung masira mo yung capsid or yung ibang laman niya. Okay? Kaya siya intact. So, yan yung mga sinasabi nilang bumangga tibag, mga ganun-ganon. So, ibig sabihin, kahit anong gawin ninyo, intact siya. Okay? Meron din ang inyong hepatitis B virus, meron siyang DNA polymerase. Anong ginagawa ng DNA polymerase? Susumbong ko kayo kay Sir JP, hindi nyo na matandaan tong DNA polymerase. Anong ginagawa ng DNA polymerase? Dulsa, +1. Sige, sa recitation, anong ginagawa ng DNA polymerase?
Tinatranscribe ko yung single DNA strand.
Ha?
Nagtatranscribe po.
Siya yung ginagamit for transcription?
Opo.
DNA polymerase is an enzyme that can perform DNA transcription. Ano ba nangyayari pag DNA transcription? Yeah, +1 ka, Miss Idulsa. Anong ginagawa pag DNA transcription, Miss Eva Bonalet? Ano ang tinatranscribe natin dyan?
Yung ano sir, yung mga nucleotide, yung adenosine, cytosine, kineme.
DNA transcription papuntang what? Itatranscribe natin siya para maging siyang ano?
RNA, sir?
Para maging RNA. From DNA to RNA yan. Okay? So, ibig sabihin, meron siyang capability to transcribe yung inyong DNA. Ang inyong Hepa B kasi nga meron siyang DNA polymerase. Now, punta tayo doon sa sinend kong picture doon sa Messenger. Sige, zoom ninyo. Kung makikita ninyo dyan, doon sa upper left, meron tayong tinatawag na HBV. Ang HBV ninyo, ito yung hepatitis B virus. Now, doon sa hepatitis B virus, meron niyang specific antenna. Okay? Yung specific antenna niya na yan ay nagbabind yan sa NTCP na tinatawag natin. Ang NTCP, makikita natin yan sa cell. Okay? Can be seen in the cell membrane of the human. Ayan. Can be seen in the cell membrane of human. Ano po ba ang ibig sabihin ng NTCP? Sabi kanina ni Ms. Aba, sodium taurocholate co-transporting polypeptide. Ayan. Yan yung first step ng life cycle na yung ibang ibang virus din ganito din yung life cycle nila. Sodium taurocholate co-transporting polypeptide, nagbabind sila dyan. Saan makikita si NTCP? Sa virus, sa human? Sa human, oo, kinikilig na naman si Alzate, nagpe-present nga, di ba? Sa ring. So, ayun. So, makikita yan. Ano po ang ginagawa pag nag-bind yung virus sa NTCP? Magkakaroon tayo ng tinatawag nating binding. So, magbabind yung virus doon sa cell membrane. So, pag nag-bind siya, pwede na siyang magkaroon ng entry. Okay, binding and entry. Sorry, binding and entry. Okay, binding and entry. Bakit? Kasi pag itong capsid, 'di ba, naaalala niyo, ito yung phospholipid bilayer ng yung capsid yung phospholipid bilayer ng virus. Tapos yung cell membrane natin, magpo-fuse yan together. Ngayon, para mag-fuse yan together, kailangan natin ma-activate si NTCP. So, kumbaga, parang sasabihin niya, okay, kilala kita, na-activate mo ko eh. Ngayon, yung capsid at saka yung cell membrane natin mag-fuse in together. Okay? Kumbaga, papasok siya. So, once na makapasok na siya doon sa loob ng cell, okay, after tayo doon sa may NTCP, ang tawag natin doon ay uncoating. Pag sinabi nating uncoating, ibig sabihin lahat ng laman ng nucleus, okay, lahat ng laman ng nucleus ng inyong virus, ng hepatitis B virus, ay nilalabas na sa loob ng cell ng tao. Okay? Sandali lang. Nag-message si Ma'am Justin doon sa GC. Basahin mo na ninyo. Kahit ako na-stress ako ng haba ng sinabi. No, wait lang. Stop tayo ng konti sa uncoating, ha? Hello, everyone. I was not able to attend the scheduled meeting earlier. I had just arrived from a commitment and I did not expect that I'd take that long. Anyway, the meeting is supposedly for your final requirement in public health. As you know, the center has an ongoing extension activity known as the RPPS, or the Remote Professional Pharmacy Practice. In these activities, students need to recruit human employees. Students need to recruit UMAC employees to become clients, patients for next semester. The primary criteria is that they are diagnosed with hypertension. Yung summer is intended for recruiting of clients and then implementation sa first semester, which is kayo din na mag-implement ng program through dispensing 2. Hindi ko nakakalanan to, dispensing 2. Each class should have 4 or more clients who will be monitored for their daily blood pressure, lifestyle, medication intake. So ibig sabihin pala, tuturuan ko nga pala kayo na mag-BP, no? So sa next face-to-face natin mga padala ng ano ninyo, ha? Palagay na lang din sa GC Mika. Kasi pala, tingnan nyo, related siya sa papagawa ni Ma'am Jen. So yung 4 patients, aalagaan nyo ng 3 months. You will be supervised by an alumni pharmacist. The catch is most of the monitoring should be done remotely via an application. So your patient should have a cell phone and data every day so you can monitor. You will be enrolled sa app so you can monitor. Para makapag-recruit kayo ng clients, mas maganda na mag-face-to-face kayo dito sa UMAC initially sa recruiting process. Then pag nag-okay sila, saka sila mag-orientation, etc. Kaya need ko kayo makausap virtually para ma-endorse call yung mga publicity materials. Mag-reply muna kayo kay Ma'am Justin ng acknowledged. Acknowledged po. Sige po, thank you po ma'am. Baka mamaya magdrama siya. Kailangan ng acknowledgement ni ma'am. So basically, hindi nyo ako mare-recruit kasi wala akong hypertension. Ayan, gusto niya yung maraming acknowledgement. Baka mamaya mapagalitan kayo pag hindi kayo nag-acknowledge pa rin. Sabi ko sa inyo. Hindi ko lang na-endorse kay Sir Grant. Kahit ako ngayon ko nga lang din alam ito. Hindi ko naman alam ito na may RPPS. Well, nag-start yung RPPS na yan sa pagkakaalam ko, kung hindi kina Gonda, kilala nyo sila Gonda? Hindi sila Gonda. Parang feeling ko tinuloy nila yung thesis ng ex ko eh. Tapos, Lagonda. Tapos ayan, napapasa na sa inyo sa generation ninyo. Ang dami kasing hanas din itong ex ko na ito. Yung bida-bida din kasi nung estudyante siya. Anyway, tapos na tayo kay Ma'am Justin. Balik tayo dun sa uncoating. Ano na kasi nangyayari pag uncoating? Pag uncoating, nilalabas yung mga nandun sa loob ng
virus.
Nung envelope or nung nucleus. So lahat, ma-expose yung DNA. Okay? Kung makikita niyo dyan sa picture, dun, after nung uncoating, sabi niya, meron siyang rcDNA at saka HBV polymerase. Ayan. May enzyme na nakadikit doon sa DNA. Makikita niyo double helix siya kasi nga double-stranded DNA yung inyong virus. Nakikita ba ninyo yung HBV polymerase? Yung kulay green? Ibig sabihin, gagamitin niya yan mamaya para mag-transcribe nung further DNA, which is happening after ng uncoating. So our next step, so una, binding, fusion and entry. Pangalawa, uncoating. Pangatlo, nuclear transport. Ang tawag natin dyan. Okay, step 3, nuclear transport. So ibig sabihin, pag sinabi natin nuclear transport, ang inyong DNA or yung viral DNA going to human nucleus. O, ayan, human nucleus. So, ibig sabihin yung viral DNA ninyo pumasok na sa nucleus ng cell ninyo. So, anong mangyayari kapag nagkaroon na tayo ng nuclear transport? Magkakaroon na tayo ng tinatawag nating transcription. Doon na papasok yung DNA polymerase ng inyong virus. Okay? Diyan na siya mag-act. So, magkakaroon na tayo dito ng transcription. So, kung makikita ninyo, para na siyang goma na may 4 na bilog-bilog. Ibig sabihin, nag-replicate. Nag-replicate yung DNA ninyo. Okay? So, sabi ni Miss Sapon kanina, +1 ka dun sa Miss Sapon ha? Sa So, ang transcription, anong nangyayari? From DNA to RNA. Okay. Kung makikita ninyo dito sa picture, yung mga ang tawag dito, yung mga nagkaroon, yung mga pumasok, okay, na DNA ng virus, nagkaroon ng transcription, ang final product niya ay viral RNA. Okay. Para saan po ang viral RNA? Magkakaroon na yan further ng translation kasi kailangan niyang gumawa ng viral protein. So after ng viral transcription, ang next process natin ay viral translation. Para sa yung viral translation, kailangan ma-translate ng cell natin ano ba tong mga RNA na to? Ano ang mga gagawin niyang protein pag tinignan niya, pag binasa niya yan? Okay? Yun ang ginagawa ng translation, di ba? Tina-translate niya from RNA to RNA going to protein. Ayan. Sa dami ng sinabi ni Sir JP sa biochem, ganyan lang naman ang niyan, ang shortcut niyan. Translation RNA to protein, DNA to RNA transcription. Okay? So ngayon, kapag na-translate yan, makikita ninyo, meron na siyang mga proteins na kailangan para makagawa ng isa pang virus, which is itong gagawa na siya ng reverse RNA to protein. So nagkaroon ng translation and then mag-undergo pala siya, ng reverse transcription. Pag sinabi nating reverse transcription, normally ang transcription natin, di ba, DNA to RNA. Pag reverse transcription, RNA to DNA siya. Yan din yung ginagawa ng mga HIV natin. Kaya sila retroviridae kasi nga pabaliktad yung transcription nila from RNA to DNA. Kaya din yan ng HBV or ng hepatitis B virus. So basically, kapag nagkaroon na siya ng reverse transcription, magkakaroon ka na ng mature nucleocapsid. And then, pag nagkaroon ka na ng mature nucleocapsid, it will send 2 signals. Number 1, okay? Pag meron ka ng mature nucleocapsid, magsisend yan ng 2 signal. Production of new virus. Number 2, pwede siyang mag-signal ng integration to host DNA. Yung number 2, i-clear out natin to, integration to host DNA. Kaya sabi ni Miss Aba kanina na forever ka nang merong hepatitis B virus kapag meron ka ganyan. Bakit? Kasi yung DNA ng virus mo nasa DNA na ng cell mo. Okay? Nasa DNA na din siya ng cell mo. Ngayon, pag yan, nangyari yan, anong mangyayari? Yung katawan natin, ang ibibigay ng signal, magre-release siya ng tinatawag nating HBsAg. Okay? Kaya, kapag nagpa-test kayo ng hepatitis B, ang makikita ninyo, ang test na usually ginagawa, HBsAg, hindi yung viral loading. Hindi. Kasi mas makikita natin kung gaano katagal na yung HBsAg na nandoon, na nagsisirculate sa katawan natin, whether maging bago man yan o hindi. Kaya natitest natin sa HBsAg kung acute siya or chronic. Okay? Kasi nga, because of the integration nung mismong DNA ng virus sa mismong katawan natin. Sa mismong DNA natin. Okay? So basically, yan yung life cycle ng ating wait lang. Okay. Ng ating HBV. Now, meron tayong mode of transmission. Paano po yung mode of transmission ng ating hepatitis B? Pwedeng through blood transfusion. Okay. Kaya kapag kunwari magpapa-check tayo ng dugo, 'di ba magdo-donate tayo ng dugo, napaka-arte nila, ayaw nila ng may tato. Ayaw nila na nagbe-mens. Ayaw nila nung dati ka ng HIV. Bakit ayaw nila ng blood transfusion at ayaw nila ng may tato? Kasi 'di ba, ang tato galing din sa needle stick, okay? So, hence, ang isa sa mga mode of transmission ng ating hepatitis B ay needle stick injury sa mga nagpapatato, okay? And then, sexual. Actually, ang HBV, most common na nakukuha ng hepatitis B is through sexual intercourse. Sexual intercourse. Across placenta, pwede siyang mamana. For example, si Lobos may hepatitis B tapos nabuntis siya. Tapos pag nanganak siya, automatic pwedeng yung anak niya. Magkaroon na rin ng hepatitis B. Next, ano po yung mga sakit na pwede nating makuha pag meron tayo ng hepatitis B? Meron tayong tinatawag na acute viral hepatitis, katulad ng sa hepatitis. Katulad nung sa hepatitis A, meron din tayong tinatawag na fulminant hepatitis. Ano po yung fulminant hepatitis? This is actually a severe acute hepatitis and rapid destruction of liver. Maano siya, kumbaga parang acute lang naman. So in a short while, mamamaga agad yung liver mo. And then pag namagayan, automatically mabilis din yung kanyang pag-destruct. So kung tatanungin niyo ko, mas delikado po ba yung hepatitis B sa hepatitis A? Yes. Next, meron din kayong sakit na tinatawag na chronic hepatitis. Bakit siya chronic hepatitis? Kasi 'di ba, nag-integrate yung DNA natin sa DNA ng virus, kaya pwede siyang nandyan. If remain untreated, hindi mo mapapatulog yung virus sa mismong cell mo. Just like sa HIV, pinapatulog lang naman natin yan sa loob ng cell natin. Pag remain untreated yan, pwede yan maging chronic hepatitis. Okay? Now, sa mga serology natin, baka lang mamaya ma-encounter ninyo sa boards. Kasi ang na-encounter ko sa boards kasi dito is anti-HBsAg nung panahon namin sa public health nga, lumabas yon. So baka lang din sa batch ninyo lumabas tong mga serology ng hepatitis. So sabi natin kanina, 'di ba, ang HBsAg, okay, ano ang meaning ng HBsAg? Dali lang, let me check. HBsAg is also known as hepatitis B surface antigen. Okay? Ito, dito natin madidetect yung disease progression mismo. disease progression. If either acute ba yan or chronic. Yan. Hindi ko na ibibigay yung medyo mga lab test niyan kasi baka mamaya mawindang-windang naman kayo. Next, may mga tinatawag din naman tayong anti-HBsAg. O, alam niyo na yung meaning ng HBsAg, ha? Kailangan na lang natin malaman ano ang anti-HBsAg. Anti-HBsAg meaning, pag mataas ang levels mo nito, immune ka. Immune. You are immune. So it provides immunity or protection against repeated infection. Kaya, kapag kayo nagpaturo, yung mga magpipikol to dito, di ba, magpapa-Hep B vaccine kayo at saka ng, anong tawag dyan? Yung tetanus toxoid vaccine. Basically, malalaman yan ng doctor mo kung meron ka bang Hep B na infection kapag mababa ay mataas yung HBsAg mo pero yung anti-HBsAg mo mababa. Wala kang infection kung dati ka na nagpa-inject tapos mataas ang anti-HBsAg mo, meaning immune ka na. Okay? Immune ka na doon sa virus mismo. So, diyan nila madidetect, nagpa-vaccine ka na pala before. Kahit sabihin mong hindi pa, pag mataas ang anti-HBsAg mo, hindi ka na nila babakunahan. Kasi nga, immune ka na. Okay? Pero may mga clinic kasi na alam mo na, pera-pera ang labanan, kailangan ma-push ang product, hindi na sila nagtitest ng anti-HBsAg, turok agad. Tatanungin lang, nagka-Hep B ka na ba dati? Hindi po. Okay, turok. Ano? Bawal kasi kapag kunwari nagka-Hep B ka na dati, bawal na. Bawal na magkaroon ka ng Hep B vaccine. Okay? Ano pang meron? Pag mataas ang levels ng IgM and IgM and HBCAG, okay? HBCAG mo, meaning meron kang new infection. Ano yung HBCAG? HBCAG is actually the viral protein. Okay, nadidetect yan sa dugo kapag bago lang kasi hindi pa siya nakapasok sa mismong cell eh. Nasa dugo pa lang siya. So pag mataas ang IgM mo, meaning lumalaban yung immune system mo dun sa foreign material, and then yung HBCAG mo, mataas siya sa dugo mo, then probably meron kang new infection. Okay? Pag mataas ang levels naman ng HBeAg mo, ibig sabihin, ang iyong Hep B na nakuha ay very highly contagious. So, pwede kang ma-isolate. Kasi anything na pwedeng mag-leak sa katawan mo na body fluid, pwedeng mahawa yung kasama mo. Okay? So, tinitest natin yan para kapag kunwari medyo mababa naman siya, okay na to isolate. Okay? And then, meron din tayong tinatawag na anti-HBeAg. Meaning, pag mataas tong mga to, meron kang immunity, so therefore, meron kang low infectivity. Now, pag meron kang HBeAg, okay, HBeAg, hindi ko lang nasabi kanina. Ano bang ibig sabihin ng HBeAg? Antigen to, ha? Antigen. This is a soluble component of the core which is a marker for active disease. Marker of active disease. Basta kapag meron kayong HBeAg sa lab test ninyo, pag tinest kayo for Hep B, ibig sabihin active yung disease ninyo. So, ibig sabihin, kailangan nyo mag-take for take-home meds, usually binibigay na natin, tenofovir. Okay. Very alam nyo na yan. Tenofovir. Kasama yan sa HIV meds na LTE, di ba? Lamivudine, tenofovir, efavirenz. Kasi, kapag nakipag-tsuktsakan kayo, Hindi lang naman HIV ang pwede nyo makuha. Pwede din yan. And commonly, magkasama talaga yan, HIV at saka HBV. Kaya kahit kunwari HIV positive ka na, sir, positive na ako, nag-iinom-inom na ako ng gamot. So, pwede na akong hindi gumamit ng condom kasi nagagamot na ako eh. Meron ka pang HBV na nag-exist, may syphilis ka pa, may gonorrhea ka pa. So, regardless, you need to use protection pa din. Okay? So, kung wala naman ng tanong, proceed na tayo ng hepatitis C. Pinakamahaba kasi talaga sa hepatitis yung hepatitis B. Kasi masyado siya maraming ganap. Okay, sige. Apologies for getting your time too much. Sige, Hepa C.
Okay, so sa hepatitis C naman, hepatitis C is a liver infection caused by the hepatitis C virus or HCV. So again, the infection can be acute or short-term, severe, or chronic long-term. So, types of hepatitis, hindi ko na siya i-discuss masyado kasi nga, ayun na yung kagaya lang siya kanina, which is dalawa, acute hepatitis C virus infection is for first 6 months after someone is exposed to the hepatitis C virus. And then chronic naman, hepatitis C virus infection, a long-term illness that occurs when a hepatitis C virus remains in a person's body. Hepatitis C virus infection can last a lifetime and lead again to serious liver problems including cirrhosis or liver cancer. And then sa structure naman, the HCV particles are spherical and heterogeneous in size, ranging 40 to 80 nanometer in diameter. Hepatitis C virus or HCV is an envelope positive strand RNA virus classified in the hepacivirus genus within the Flaviviridae family. Hepatitis C virus has an outer envelope containing two viral envelope proteins, which is the E1 and E2. Underneath the membrane is a layer of the viral core protein, which leads to the viral genome forming the nucleocapsid where the RNA is located. You can think of it like a capsule or capsid that holds nucleic acid or nucleo, in this case of RNA. So in the DNA, the viral genome of hepatitis C virus is a single-stranded RNA that encodes 11 proteins. So on its life cycle, the hepatitis C virus or HCV replication cycle, ito nakuha ko lang din sa Google, which is magandang source naman din kasi wala din talaga siya sa book and yung bilang talaga ang meron doon. So there are 7 steps of viral life cycle dito sa hepatitis C. It indicated sa white boxes dyan kung nakikita nyo. So first is attachment. We have the viral particle surrounded with lipoproteins that binds the target cells by interacting with several receptors. So papasok na yung entry following attachment. The virus enters through clarithin-mediated endocytosis. Next is uncoating. Kagaya na sabi ni Sir, lahat ng laman ng nucleus sa hepatitis C virus is nilalabas sa loob ng cell ng tao. So, may expose ang DNA. And then, so ang coating nga, cellular and viral membranes fuse and the capsid is disorganized with a process triggered by the low pH of the endosome. After uncoating, the positive strand RNA genome is released into the cytoplasm. Ngayon, mag-undergo siya through translation. So, sabi ni Sir kanina, kailangang i-translate para malaman kung ano ang gagawin ng mga RNA na RNA going to protein. So, with that, the genomic RNA is directly translated in a polyprotein precursor. And then, now, replication naman, the non-structural proteins and some host factors form a replication complex that synthesize multiple copies of the HCV RNA genome via a minus-strand replicative intermediate. And then next is assembly and maturation. It is a packaging of viral progeny, progeny takes place. And then it follows release. So, sa release, virions are released from the cells most likely by exocytosis or transmitted to other cells via a cell-free mechanism. So, now the symptoms. of hepatitis C. Again, kagaya lang din kanina, fever, malaise, loss of appetite, diarrhea, nausea, abdominal discomfort, dark-colored urine, jaundice, or yellowing of the eyes and skin. So when it comes to the epidemiology or transmission of hepatitis C, so ang hepatitis C virus daw is a blood-borne virus, and most infections occur through exposure to blood from unsafe injection practices. So you can see the reuse or inadequate sterilization of medical equipment, especially syringes and needles in healthcare settings. Also, unsafe healthcare, and then unscreened blood or blood products transfusion. Also, injection drug use or injecting drug use through the sharing of injection equipment. And lastly, sexual practices that lead exposure to blood. So HCV or hepatitis C virus is napapas siya from an infected mother to her baby and via sexual practices that lead to exposure to blood. For example is yung mga people with multiple sexual partners. Ganon. However, this mode of transmission naman daw are less common. Hepatitis C is not spread through breast milk, food, water, or casual contact such as hugging, kissing, and sharing food or drinks with an infected person. Next is the diagnostic test. Testing for anti-HCV antibodies with a serological test identifies people who have been infected with the virus, or it detects the presence of antibodies to the hepatitis C virus. Antibodies are chemicals released into the bloodstream when someone gets infected. So if the test is positive for anti-HCV antibodies, a nucleic acid test for HCV ribonucleic acid RNA is needed to confirm chronic infection and the need for treatment. Alam naman natin that usually result is either positive or negative. So let's discuss first if the hepatitis C virus HCV is positive. So may tinatawag na HCV antibody positive or known as reactive. A positive hepatitis C antibody test means that the person has sometimes been exposed to the hepatitis C virus. Hindi siya necessarily means na that person is currently infected. Kaya it needs to undergo a confirmatory test para ma-determine if yung person is currently infected ba siya or hindi. After infection, the hepatitis C antibodies stay in the blood permanently, even if the virus is no longer present. Sabi doon, lahat daw ng tao with a positive HCV antibody test should have a confirmatory HCV RNA test para i-determine ang presence ng active infection. It is recommended that the confirmatory test should be taken from the sample test, either through venipuncture or dried blood spot testing or DBS is used for the antibody test. Roughly 1 in 5 people who are infected with hepatitis C spontaneously clear the virus completely without needing any treatment. However, it is important to note that even if someone has previously cleared the virus, any future exposure to the virus could cause infection. Having hepatitis C antibodies does not give immunity against reinfection. Next, how about naman if ang result is negative? May tinatawag na anti-HCV negative or non-reactive naman. If the anti-HCV test is negative, it usually means na that person is di talaga siya infected with hepatitis C. However, results may be negative in early acute hepatitis C and during the window period or in people with weakened immune systems. In this situation, and where a person has been exposed to risk of infection during the window period, ongoing monitoring and follow-up testing should be offered. So people with suppressed or weakened immune systems, including those with HIV or those receiving certain medication, including immunosuppressant drugs, are not always able to produce antibodies. Also, using an enzyme immunoassay or EIA or similar testing technologies. Anti-HCV antibodies are detectable in the vast majority of people with hepatitis C infection. So, sa first-line drug treatment naman, there are effective treatments for hepatitis C. The goal of treatment is to cure the disease and prevent long-term liver damage. Antiviral medications, including sofosbuvir and daclatasvir, are used to treat hepatitis C. Some people's immune system can fight the infection on their own, and new infections do not always need treatment. Treatment is always needed for chronic hepatitis C kasi ayun nga yung sabi kanina na tumatagal talaga. People with hepatitis C may also benefit from lifestyle changes such as avoiding alcohol and maintaining a healthy weight. With proper treatment, many people can be cured from hepatitis C infection and live healthy lives. So, dito naman sa hepatitis C, hanggang ngayon is wala daw siyang vaccine. So, compared with A and B, may vaccine sila. For C, wala siyang vaccine. So, ayun. Again, to summarize sa difference with the three, hepatitis A is spread through the stool of an infected person. Hepatitis B is through bodily fluids, and hepatitis C is spread through blood. Ayun po.
Okay. That is very clear naman. Nabanggit mo ba yung ano niya, yung family niya?
Yes,
That is,
sir.
ang hepatitis C ay saan
Ay
siya?
from Flaviviridae family po, sir. Hepasivirus genus.
Flaviviridae. Ang Flaviviridae ay isang ano? DNA o RNA?
RNA po, sir.
RNA siya. So, hindi siya DNA virus ha. So, kung mapapansin ninyo, hepatitis A is DNA, hepatitis B DNA, hepatitis C is RNA virus. Okay, RNA virus. Kaya hindi natin sila pwedeng i-collect lahat as DNA virus. Kaya hepatitis ang tawag natin sa grupo nila. Okay, now, ang RNA virus na hepatitis C ay single-stranded. So, isa lang yung strand ng kanyang ng kanyang RNA. Single-stranded siya. And then, enveloped with icosahedral capsid. Ano pinagkaiba niya sa hepatitis A? Naked ang hepatitis A pero same sila ng merong icosahedral capsid. Okay? Magpapalito. Ang envelope, hepatitis C. Ang naked, hepatitis A. Okay? So, yun lang naman yung basically sa morphology. Yung transmission niya, since pareho sila ng hepatitis B na sexually transmitted disease, pareho sila na blood transfusion, needle stick injury, sexual contact, at saka across the placenta. Pwede siyang makuha from mother to fetus. Okay? Next, ano po ang pwede niyang maging sakit? Yung mga clinical something niya, basically, acute viral hepatitis lang din naman. Viral hepatitis. Yan. Tapos, pwede ka rin magkaroon dito ng chronic hepatitis kasi nga, sabi ni Ms. Aba kanina, i-integrate din siya sa ating katawan kasi nga sexually transmitted disease yan. Now, usually, ang pinagkaiba ng hepatitis C sa hepatitis B, given na alam natin na DNA ang hepatitis B at RNA ang hepatitis C, yung treatment. Sa Hepa B, ang treatment natin ay usually tenofovir at saka entecavir. Sa naman, sa hepatitis C, pag long term or kapag kailangan talaga ng gamutan dyan, sofosbuvir and daclatasvir. Ano ba yung daclatasvir? Pero, meron pang isa, kapag meron tayong talagang infection na hindi na effective yung sofosbuvir at saka daclatasvir, yung interferon and kino-combine siya sa ribavirin. Ayan. Ayan yung additional na kanyang treatment. Okay? Next slide, hepatitis D.
Okay, for hepatitis B, so hepatitis B is also known as delta hepatitis. So itong delta hepatitis na to this is a viral hepatitis that is infection that causes liver inflammation and also damage. So, several different viruses can cause hepatitis, including na dito yung mga na-discuss kanina, yung hepatitis A, B, C, and I will be discussing hepatitis B and E. So, the hepatitis A and E, syempre, yung mga viruses na typically cause to ng mga acute infections. And yung hepatitis B, C, and also D naman, ito yung mga viruses na can cause acute and also chronic infections. So, hepatitis B virus, the only member of genus Delta virus is from Delta viridae family. So, this is a negative stranded RNA virus that depends on a DNA virus from the family of Hepadnaridae for also propagation but not for any RNA replication. So this is a composed of outer lipoprotein envelope made of surface antigen of the HBV or also known kanina na HBsAg. Ito yung inner ribonucleoprotein structure in which yung HBV natin, itong hepatitis B viruses genome resides. So HBV small and spherical virus. Yung viral genome nito is a circular, single-stranded, negative sense to ng RNA molecule. And also meron tong internal core delta antigen na may surrounded ng envelope na derived siya from HBV surface protein kasi connected si hepatitis B kay hepatitis B. So for the life cycle ni hepatitis B, during an hepatitis B virus infection, the infected cell produce two viral proteins, which is yung the large and the small hepatitis B antigen, na nagpe-perform ito ng different function. Yung small na antigen, siya yung nag-i-increase ng genome replication, while sa large naman, yung large antigen, siya naman yung taga-promote ng virus particles para mag-formation. So therefore, yung mga small antigen, nagdo-dominate siya sa early phase ng cell infection. And wherein yung large naman na antigen is siya yung naging abundant in later stages ng hepatitis B. So dito sa life cycles nila, yung hepatitis B virus life cycle, yung virus nag-enter sa hepatocytes via the NTCP. And yung HBsAg niya and yung RPN, which is yung ribonucleoproteins, sila yung nagsiseparate and yung genome nagmamigrate siya into nucleus. So inside the nucleus, nagkakaroon ng several copies ng mga anti-genome na are produced from genome via rolling circle mechanism. So ayun yung dun siya parang ayun yung gamit niya yung rolling circle mechanism. So this serve as the template ng mRNA. Ito yung magiging template natin ng mRNA synthesis from which yung mga small HBAG natin is magiging translated na. So, in addition to this life cycle, yung antigenome natin is edited na siya by the adenosine deaminase. So, yung edited na antigenome natin, magsaserve siya as template for mRNA synthesis from which magiging translated na siya. Subsequently, yung copies ng genome, mapuproduce na siya ng antigenome via rolling circle mechanism. So, pag yung together niyan, pag yung dalawang yan nagsama na, yung 2-HBAG, magpo-form siya ng ribonucleus protein, and which is mag-envelope siya sa ABSAG in an early Golgi compartment and magiging secreted na siya. So, sa symptoms naman, possible maramdaman ni patient when he or she infected by hepatitis B is yellow skin and eyes, stomach upset, pain in your belly, throwing up, fatigue, not feeling hungry or anorexia, mga joint pain, and also dark urine and mga light-colored stool natin. Next slide po.
Wait lang. Hepatitis B pa din yan? Okay. Sige.
So hepatitis B, when it comes naman sa epidemiology niya, yung transmission niya is yung hepatitis D virus natin is found throughout the world naman siya. Pero ano siya, non-uniform distribution. So, mga highest prevalence lang naman na reported dito is yung mga taga-Italy, Middle East, Central Asia, mga taga-West Africa, and also mga South America. So, yung HBV natin, infects naman siya ng all age group. This is also a person who have received multiple transfusion intravenous drug abusers, and also yung mga close contact nila na nasa high risk na ng having hepatitis B. So the primary route of this transmission are believed to be similar to those HBV, since sabi ko nga is connected si hepatitis B kay hepatitis B. So yung HBV natin, although etong hepatitis B, hindi to nag-a-appear as sexually transmitted disease, and ito ay nag-infect depends on sa hepatitis B replication dahil yung hepatitis B natin is nagpro-provide ng HBsAg, which is the hepatitis B surface antigen envelope para sa hepatitis B natin. So hepatitis B is spread when blood or other fluids from a person infected with the virus enters the body of someone who is not infected. So hepatitis B virus is transmitted primarily by parental exposure to blood of HBV infected people. However, sabi dito, ang infection can only occur in those already infected with hepatitis B. So for diagnostic test naman, ni hepatitis B is blood test and also liver function test. Dahil, syempre, to make an accurate diagnosis ng physician, kailangan mag-perform ng blood test na kayang makadetect ng anti-hepatitis B antibodies sa blood mo. And if yung antibodies mo, yung mga antibodies is nakita sa'yo, syempre, ang ibig sabihin nun, you've been exposed sa virus. So yung doctor, syempre, magta-try din siya ng liver function test if they suspect you na may liver damage ka. Kasi nga ang tina-target nga ng mga hepatitis is liver inflammation. So, for the first line treatment natin, sabi, based on kasi sa book, wala ding nabanggit na exact treatment for this kind of hepatitis. So, they are known treatments for acute or chronic hepatitis B. Pero unlike other forms of hepatitis, current antiviral medications don't seem to be very effective sa pagtitreat ng HBV. So, sabi, you may be given large doses of medication called interferon for up to at least 12 months kasi interferon alpha 2A, siya yung ni-use for several small studies to treat hepatitis B virus infection. So, for the prevention of this, ang delta hepatitis, mape-prevent siya by vaccinating HPV, yung hepatitis B nga na susceptible persons siya with hepatitis B vaccine. However, yung mga vaccination naman does not protect talaga hepatitis B carriers from superinfection ng hepatitis B virus po.
Okay. So, to formalize yung sinabi ni Ms. Aicardo, ang hepatitis D is hindi siya infective or wala siyang pathogenic component or capacity if hindi siya combined with hepatitis B. Okay? Nagiging infective lang siya kapag kasama siya ni hepatitis B. Hepatitis D alone is not infective. Okay? Bakit kailangan niya yung hepatitis B? Para makapag-produce ng HBsAg. Okay? Kailangan niya yung hepatitis B para makapag-produce ng HBsAg. Ngayon, kung wala si hepatitis B, hindi siya magiging infective. Kaya hepatitis D is usually ang sa choices ng board exam nilalagay dito is complementation with HBV. Pag may nakita na kayong ganyan, which among the hepatitis virus is usually complemented with HBV, lagi ninyong tatandaan, hepatitis D yon. Hepatitis D. since ang hepatitis B ninyo ay sexually transmitted disease, definitely hepatitis D will only be activated if nagkaroon ka rin ng sexual intercourse. Kaya ang inyong transmission ay same lang sa hepatitis C and hepatitis B. Okay? Now, co-infection ang usually meron sa mga to, co-infection. Co-infection with HBV plus HIV. Okay? Or HBV plus HDV. Ayan. Meron din namang mga super infection. Okay? Super infection, ibig sabihin, nagkaroon ng hepatitis B or hepatitis D virus ang patient na may chronic hepatitis B. Ayan. Complications, kapag nagsama ang Hepa B at Hepa D, pwede ka magkaroon ng fulminant hepatitis, yung katulad sa Hepa B kanina, and liver cirrhosis. Nagkakaroon ng peklat yung liver mo. Yun lang naman ang dapat ninyong tandaan sa Hepa D. Lagi siyang paired with Hepa B. Okay? Proceed tayo ngayon sa Hepa E.
So for hepatitis C, the hepatitis C virus can present as either non-enveloped virus, where the capsid shell interacts with the surrounding environment. Or pwede rin siyang sabihin na quasi-enveloped virus shell, where the capsid naman is coated with an exomal membrane. Although both viral forms are infectious, yung mga non-enveloped virus is 10 times more infectious than the quasi-enveloped form. So this is hepatitis E, syempre is also an inflammation of the liver caused by hepatitis E virus. So hepatitis E virus is classified in the genus Orthoheptavirus of the Hepaviridae family. And this is one of the most common causes of hepatitis in the world. So here in replication cycle, the HEV genome reassemble mRNA with a 5' cap and a 3' polyase structure, which is a small non-coding region. This is located to sa 5' end ng genome, and this is followed by open reading frame or yung ORF1 natin na nakikita sa figure na may ORF2 saka ORF3. So, ang nag-encode to ng non-structural proteins, necessary lang siya for replication. Necessary for replication na may predicted molecular mass, like mga 185 kDa. So, yung ORF1 natin and yung dalawang bidistronic overlapping reading frame, yung ORF2 and yung ORF3, is magse-separate siya by a small cis-reactive element or yung CRE site. Then yung 3' and also nagko-contain din siya ng NCR and poly-A tail. So after ng polyprotein is translated, yung replication ng viral RNA and RP, magpo-proceed siya ng magsisynthesize siya ng negative strand ng mga RNA. So, ganun yung replication cycles niya. And for the symptoms naman, same lang din na yellow skin eyes, fatigue, not hungry, joint pain, dark urine, and also light-colored stool. And for the epidemiology naman, the virus is transmitted via the fecal oral route, principally via contaminated water. So dito, in developing countries, kung saan yung mga HEV, genotypes 1 and 2, ito yung mga most common source ng hepatitis E virus, yung mga infection na contaminated, like kunwari mga drinking water, ganyan. And yung route of transmission din ng hepatitis E is mainly through mga gastrointestinal tract natin or known as mga fecal oral route, And ito is, syempre mga ano to, like mga humans na nag-ingest siya ng food and also yung mga nag-drinking water na contaminated na ng virus. So, yung hepatitis C virus, nag-spread din siya also sa mga poop. And also, you can catch it. Ito yung sinabi kanina na sir, na sa mga poop. And you can catch it if you drink yung virus ng hepatitis C, if na like, kunyari na-drink mo siya ng accidentally, it's possible na mahawa ka. So, given lang dito is syempre yung mostly common to kapag sa mga parts na may mga poor hand washing, ganun, yung mga hindi din malilinis yung water. So, eto, madalas lang to nangyayari sa mga US. Kasi yung water nila and yung mga sewage nila doon is nakikill ng virus before pa makaabot sa mga drinking supplies nila. So you can also get hepatitis C if you eat mga undercooked meat from infected animals. Kapag na mga infected animals na yung mga pinagkakain na hindi natin alam, such as siguro yung mga pigs or mga deer. So less often naman ito, you can get the virus from raw shellfish that comes from tainted water. So for the diagnostic test naman ng hepa E, detection of a specific anti-HBV hemoglobin M antibodies to the virus in a person's blood. So yung physician natin, mag-a-ask siya ng medical history natin and yung details about your symptoms. Siyempre, mahalaga din na sabihin natin if we have a recent travel sa iba't ibang country, and also we need to tell the physician if you have might contact with water contaminated by sewage or nagkaroon ka ng contact sa sa mga contaminated water or food na nakain mo dun sa lugar na yan. So for the first line, also, ano rin pala, addition sa diagnostic test is also yung doctor is test din siya ng stool test and also ng blood test para ma-diagnose if you have hepatitis C. So, for the first line treatment ng hepatitis C, this din sa libro kasi there is no specific antiviral therapy for acute hepatitis C. Physician should syempre offer supportive therapy pa din kasi yung mga patients syempre typically ina-advise lang sila na mag-rest, magkaroon ng mga fluids sa katawan and yung nutrition, i-avoid yung mga pag-iinom, and also kailangan nilang magpa-check sa physician syempre bago mag-take ng any medication kasi possible yun na makadamage sa liver nila. Syempre especially doon yung acetaminophen nga, since dito no vaccine can prevent the hepatitis E virus, and this is most common sa mga less developed country in Asia, like mga Central America, ganun, Africa, Middle East. You can lower your chances of getting naman this virus if hindi ka masyadong umiinom ng tubig na contaminated or use ice na hindi mo naman talaga alam if malinis. And pwede mo rin maiwasan to if you don't eat undercooked pork, mga meat, or yung mga raw shellfish. And also, syempre, wash your hands lagi. And after mo mag-bathroom, syempre, kailangan pa rin laging malinis yung hands, and also bago ka mag-prepare ng food or kumain ng food. And magdadirect sa mga bunganga natin or sa mga butas sa ilong. Ganun. Ganun po.
Okay. So, to formalize, ang mga tanging ninyong tatandaan with hepatitis E, nasan na yung chat box? Bakit nawala siya? Ayun. Ano ba yung mga, nabanggit mo ba yung family kung saan belong si hepatitis E? Hepatitis E is belong to Hepaviridae. Hepaviridae, which is an RNA virus. Single-stranded RNA lang siya. And naked. Pag sinabi natin naked, ano ang wala sa kanya? Siyang envelope. Meaning, walang nagpo-protect doon sa nucleus niya. Okay? Ang tanging protection lang niya ay ang capsid. Okay? Now, yung transmission nito ay katulad ng hepatitis A. Fecal-oral route. And then, given ang transmission niya ay fecal-oral route, ang pwede ninyong makuhang sakit sa kanya ay hepatitis A-like disease. And they are sige, highly merong high mortality in pregnant women. Most likely ang mga may hepatitis E, mga buntis. So, yun lang naman ang additional ko for hepatitis E. So, mag-break kayo balik kayo ng 5:40, tapos proceed tayo ng DNA virus. Okay? Balik kayo ng 5:40 para lang hindi kayo mawindang-windang pag tuloy-tuloy. Sige. See you 5:40.